Hi guys, Dr. House here, facial plastic surgeon. It's been an exciting few weeks at the launch of House MD Plastics, and I'm honored to have welcomed so many of you to our clinic. I've been asked along the way by several people of how and why I became a facial plastic surgeon, so I want to do a brief overview of the training process and answer some of those questions. As you probably know, all physicians are required to complete 4 years of medical school. In the United States, this is typically done after 4 years of college or university. In my case, I graduated from the University of California, Davis with a bachelor's degree in microbiology. After this, I went to Boston University for medical school, and I, like some people, decided to do a master's in addition to medical school, where I did my thesis on biomedical imaging and conduction with Caltech in Pasadena. So after medical school, we're then required to do residency training. And this is when a doctor specializes in a field such as surgery or emergency medicine, radiology. The length of that residency varies, but for surgical subspecialties, they require at least 5 years. So if you ask any doctor about the match into residency and finding a spot, it's really the biggest stressor of the path. In my case, I matched to otolaryngology head and neck surgery at the University of California, San Francisco. So during this application process, somewhere between 300 and 400 medical students apply for the only 4 spots that were available at UCSF. So I feel so fortunate to have had the opportunity to train at such an amazing program. So now after residency, a head and neck surgeon must then undergo a written and oral examination to become board certified. Then they can go practice as a head and neck surgeon or elect to specialize further in something like facial plastic surgery. So this is what's called a fellowship. And I had the great opportunity of training in Beverly Hills with some of the top surgeons in the world. I'll do my facial plastic surgery fellowship with Dr. Nassif and Dr. Babak Azizzadeh. This is again followed by an oral and written examination to get board certified, which is completely separate from the head and neck surgery exams. So as you can tell, this is quite a long path. 4 years of undergraduate education, 4 years of medical school, 2-year master's, 5-year residency, and another year of fellowship. That's a total of 16 years of higher education and training. But that dedication, in my opinion, is so incredibly rewarding. I love having the ability to help make my patients look and feel amazing. And this is really what drew me to the field. I mean, when people say, I'm a facial plastic surgeon or plastic surgeon, there's a certain stereotype that comes to mind, but really what we're doing is restoring your sense of self, whether it be after a facial trauma or skin cancer removal, or if we're addressing just natural changes that come with aging. My goal is to give you pride in your appearance and help you go out and face the world with confidence. Thanks for listening. I hope you now have a better understanding of what it takes to become a facial plastic surgeon. I answered some of those questions. It's, in my opinion, the best job in the world. If you have any more questions about this or other things related to the field, please let me know in the comments below. And thanks for watching. I look forward to seeing you in clinic.